This is a hospital which from the outset has said, what tools would you like to best do your job? Tools which when you hold them in your hand are you almost feel like they've been tailor-made for you. It's a real pleasure. And that makes it an enormous difference, I think, to the comfort of a surgeon. To be in a situation where you say, this is my preference and it's delivered, then I think enables you to take your skills to that even higher level.
We've worked in partnership with surgeons rather than employing surgeons. What it gives us the opportunity to do is work with excellent NHS consultants who also have a private practice. If you work in a dedicated eye facility, then all the staff are eye trained, everybody from the secretaries to the technicians. We have opticians, the nursing staff, the operating theatre staff are super specialised themselves in ophthalmology. So not only are the surgeons super specialists, but also the staff that we work with. And that's a huge advantage. It makes for a really comfortable working environment, and you can work to the highest possible standards in those circumstances. Amazingly, even though the eye is such a small structure, within ophthalmology we have super specialists. So for example, I now only do cataract surgery, lens surgery and laser eye surgery, so just the front of the eye. Other people will just do eyelid surgery. Some surgeons may just do retinal surgery, which is the film at the back of the eye. For example, macular degeneration, a disease of the aging population, is the commonest cause of blindness in the Western world, and we have people who just specialise in that.
They're surprised to see the quality of the environment in which they get treated, but more than anything they are surprised of the service level and the quality of interaction with our staff, with our nurses, the doctors, the dedication and the time that every individual gets when they come in one of our clinics.
I think that one of the most important things to reassure a patient is to communicate well with them. Because if we understand what's happening and we understand the advantages and disadvantages and the benefits and the risks, and we're fully informed, then it puts us in a much more relaxed position.
We make sure that surgeons have enough time to interact properly with each patient.
The aim is always to try and make it better than going to the dentist. So that's your kind of point of reference. So you want people to say, oh, it was much easier than going to the dentist.
In contrast, if you're in and out seeing the surgeon and you spend 2 minutes with them and you don't have all your questions answered, then I think that people then become apprehensive because they don't know what to expect. And I think that not only the surgeons of Optegra, but throughout the laser vision correction industry, the standards are much, much higher than they were. And also now the Royal College of Ophthalmologists has published some very stringent guidelines, which is also clamping down on any bad practice.
So my name's Claire O'Donnell and I head up Optegra's Eye Sciences division, which is the not-for-profit research arm of the business. And we currently work with over 100 consultant-level ophthalmic surgeons who are always delighted to share their knowledge and expertise, both with medical and non-medical audiences. Patient-reported outcomes are an increasingly well-recognised essential tool for any healthcare provider. You know, in the past decade or so, there have been lots of new approaches that really have transformed the lives of patients who, in years gone by, would have had a very poor prognosis for clinical outcomes. And nowadays we're able to offer a whole range of different medical and surgical treatments, including, you know, the implantation of tiny telescopes into patients with advanced stage disease.
And another huge advance has been in laser eye surgery. So that, you know, I've been doing laser eye surgery since 1994, and when we started, we could only treat a small proportion of patients because the technology for diagnosing and examining the eyes wasn't good and the lasers weren't precise enough. Now, we can treat almost anybody who wears spectacles. It's just phenomenal how technology is enabling us to treat people more effectively.
I can tell you why I came. I can tell you that the reason why I personally came to the UK is for the openness of this country, the ability of this country to understand and to work internationally, the quality of the people that actually have a international experience and have very solid values that can be relevant for all the people around the world. And that's why I came to the UK, I came to London to lead this company. Optegra has been founded with the vision of becoming the most trusted and known international eye healthcare provider. We have been fortunate to be able to expand from our first hospital 10 years ago into 7 full-fledged, dedicated eye healthcare hospitals in the UK, of which this one in London is the flagship. We continue the expansion in the UK, and we will be opening more locations across the country in the near future. But we have also expanded the franchise of Optegra and brought this quality of the UK healthcare abroad. We are present with a total of 20 hospitals internationally across Europe and in Asia. And every time that we open up an activity and an operation in another country, we make sure that we hire the best doctors, that we build the best facilities, that we recreate the quality of the experience and the quality of the delivery of the medical outcomes that we expect for every patient here in the UK.